Tonight, Health Secretary Robert F. Kennedy Jr. is doubling down on his calls to ban fluoride from public water supplies. Kennedy told the Associated Press he plans to direct the CDC to stop recommending fluoride in drinking water or fluoridation nationwide. It's a move that will reverse a decades-long practice, which the CDC has called one of the greatest public health achievements in U.S. history. The mineral has been added widely to water in the U.S. since the 1940s. Kennedy was in Utah on Monday to support that state's new law banning fluoride from public water.
I'm very, very proud of this state for being the first state to ban it, and I hope many more will come. In the era of fluoridated toothpastes and mouthwashes, it makes no sense to have fluoride in our water.
All right, so that brings us to this location. Dr. Gorecki joins us. Grand Rapids was actually the first city in the world to actually add fluoride to its water back in 1945. This practice has been a long history. I know that you have obviously important perspective on this because we're trying to cover all sides of this issue. You're a dentist over in Warren. When you hear this news and this information, I know you are a part of the board, a member of Michigan Dental. What is some information do you think that we need to know as quote consumers, as parents who send our kids to the dentist in reference to this?
Well, thanks for having me. I think the biggest thing is that dentistry has always been about prevention, and fluoride has really been shown to be one of the best ways to end up preventing decay. And I'm glad you mentioned the study in Grand Rapids.
Because that was interesting. I didn't know that until we started doing the study. So they started it in Grand Rapids and they did the one test city, and then they compared it.
They compared it with Muskegon, and the decay rate was going down so quickly in Grand Rapids that they had to stop the study in Muskegon, to add fluoride into Muskegon.
So what would you say are some of the concerns in terms of communities, in terms of, what's next?
I think the problem will be is if we do end up removing the fluoride, that the people that are going to suffer the most are the low-income individuals that don't have access to care. And so what will happen is the kids will suffer the most. They're going to have a lot of pain. They may ending up missing school. They may end up, if their decay is that bad, going into the operating room. So it ends up being a very big issue in terms of you need to try to stop that decay.
Let's bring in that study, JAMA Pediatrics. They did a comparison in terms of with fluoride and IQ. Kind of give us some perspective on that.
So
what that all means.
Yes, that was a real poor study that was done actually in China and in India, and it was at double the rates of fluoride at 1.5 parts per million. The dentists recommend 0.7 parts per million, so there are no studies that are showing that there's any kind of connection with lowering IQ.
Okay, that's good to clarify. So the last thing, what do we do? Let's just say this goes, there's obviously things that parents can do if this went that far.
Well, we want to just make sure that everybody gets their regular visits as best they can, and we want to try to help prevent that decay. So we want to make sure that the fluoride stays in the water.
Okay, well, we'll be covering the issue. Should fluoride be in our drinking water? We appreciate your perspective.
Oh, thank you very much. I appreciate being here.
Yeah.
Thank you.
First time on TV?
It was.
You did pretty good.
Well, okay. Pretty good.
We were talking pretty good. No,
Okay,
you did really good.
I can do a little bit more
right.
practice.
Thank you very
so
much. We'll send it back to you, Devon.